As a rural health clinic, we're required annually to have an annual review. So within the annual review, there are a number of things that we have to cover. First and foremost, you have to have a diverse team that's reviewing your program. So you have to include a physician, you have to include a nurse practitioner or a physician assistant, you have to include a person not employed by the clinic. And then we also have the lead medical assistant, the lead receptionist, and then a couple of other members. So there's generally 6 or 8 of us. I book lunch and we go and we sit and we chat. And we talk about what are we doing? What are we doing well? What barriers are we having? What do we want to see for improvement? There are some compliance things that review, like utilization of services. One of the things we're looking at right now is we recognize that we order too many CT scans and MRIs, and that's an expensive service, so we're actually reviewing that. So that would be an example of utilization of services. We look at, are we taking patients with inability to pay? Are we open to Medicaid? Are we open to Medicare? So we look at all of those different things for utilization of services. Another piece of that review is you have to have a policy on what charts you review. So you have to have a policy in place for reviewing charts, and that would be, you can say you're annually reviewing 10 charts, you can review 100 charts, but whatever your policy says is what you have to do, and you have to include that report in your annual review. So the main lesson here is set up your policy so that you can be successful, and then follow that policy and then document that you've done those reviews. And then following up from these things that you've learned, it's not just that you've met once a year and you've annually done this meeting, but they want to see what did you do with what you learned from that. So we learned we had a problem with sterilization. So now what did we do to improve that process? We have a number of clinics and there was a lot of variability in how sterilization of instruments occurred. So there was no standard process across all of the clinics. So it's not just that you have this once a year meeting and then you're done. That's just the launching point for quality improvement projects and setting goals for the next year. They're going to want to see what did you find and what did you do to remedy what you found that were problem areas.